My name is Sarah Samronaika. I am visiting from Wichita, Kansas, and I just had the gastric sleeve with Dr. Lopez. Well, most of my information, I kind of used my sister. She's a nurse, and she helped me. She worked with another nurse who had visited here about 3 years ago, and she has had amazing results, and she's kept her weight off, and she couldn't say enough nice things. So me and my sister both got on the internet. We looked at the website, looked every little page we could, and then from there the Google searches, anywhere that there could be reviews, just searching those reviews and how that went, and then just researching which surgery would be best for me. I'd always been interested in the sleeve because I just know so many people that have had it done and have had really good successes. So I really had just never seen anything negative about Dr. Lopez or the ALO Bariatrics. So I really had a good feeling that I found the good fit for what I needed to do. They have a Facebook group where it's just kind of open discussion amongst people that have been here, people that came years and years ago versus people that just left a couple days ago. And honestly, I feel like at every point in this process, it's like I was like, oh yeah, I saw someone say that this is what would happen, and it really was from start to finish. I really feel like I kind of knew what to expect, and it played out just as I thought it would. So we got here about 7:30 in the morning. It's beautiful outside. It's kind of right off kind of the main drag, so right there it's pretty quiet right in front of the hospital. So there's not like a ton of cars just right in front driving by. But the hospital itself is beautiful. There were fresh flowers, and it was almost like you're at a resort, I guess, in a way. And the rooms have been incredible. And the comfort level, like our first waiting room had these awesome massage chairs. We just got to hang out, watch TV, and get massages. And then, they just had extra added comfort in every place we sat. There'd be blankets and entertainment and just things to kind of keep you busy. So it's been a really great experience at this hospital. So he had just walked in for the morning, and he saw us in the initial waiting room, and he came in and introduced himself, asked our names, and then he said he'd be seeing us shortly. And then right before surgery, he came in the room, gave us the breakdown of what to expect, a little bit about the procedure itself, and then he, anything that we could think of, he's just like, please ask. And then, I think in that moment, a lot of us, we felt like we'd gotten our questions answered, but he was like, if anything comes up at any time, to please reach out. So very warm, very welcoming, really gave you that feeling of being in good hands. Honestly, I would say overall, it's been really good. Like Chris had said, the first day waking up, definitely that soreness there, kind of the grogginess, but the pain management has been great. They definitely would take care, the nurses and staff would take care of it before it really became too big of an issue. They encourage you to get up and walk immediately, and as long as you're doing that, it's kind of gonna help with the pressure and just some of that pain. Now that we're taking our meds on our own, that's going really well too, and it's a huge difference from day 1 to day 2. So it's already, and I already feel like we're getting close to being able to leave the hospital, and I felt good to go. Like I feel like I'm okay to leave.